सो आज चाहिँ हामी एक्जिला पढ्नेवाला छौँ एक्जिला सो एक्जिलाको सुरुमा इन्ट्रोडक्सनबाटै जाऊँ है सो एक्जिलाको इन्ट्रोडक्सनबाट जाऊँ सो एक्जिला इज ट्रङ्केटेड पिरामिडल है इट इज अ ट्रङ्केटेड है ट्रङ्केटेड पिरामिडल है ट्रङ्केटेड पिरामिडल स्पेस है इट इज ट्रङ्केटेड पिरामिडल स्पेस बिट्विन अप्पर पार्ट अफ आर्म है आर्मको अप्पर पार्ट एन्ड चेस्ट वाल है सो चेस्ट वाल र आर्मको अप्पर पार्टको ट्रङ्केटेड स्पेस है सो यहाँ हेर स्पेस बिट्विन अप्पर पार्ट अफ आर्म एन्ड द चेस्ट वाल है ओके सो ट्रङ्केटेड पिरामिड है सो ट्रङ्केटेड पिरामिड भनेको काटिएको के जस्तो दिस इज द पिरामिडल सेप है दिस इज द पिरामिडल सेप ओके दिस इज पिरामिडल सेप एन्ड इट इज ट्रङ्केटेड भन्नुभयो त ट्रङ्केटेड भनेको यहाँ हेर है सो इट इज ट्रङ्केटेड भनेको यसरी काटिएको कि सो यसरी काटियो भने इट इज नट ए ट्रङ्केटेड पिरामिड है सो इट इज नट इज ए ट्रङ्केटेड पिरामिड के सो यसरी हेऱ्यो भने यो चाहिँ ट्रङ्केटेड पिरामिडल सेप है सो दिस इज द ट्रङ्केटेड पिरामिडल सेप है दिस इज ट्रङ्केटेड चाहिँ यसलाई भन्छ सो यु क्यान सी ओभर हियर दिस एक्जिला इज अ ट्रङ्केटेड लाइक हियर है सो दिस ट्रङ्केटेड है ट्रङ्केटेड पिरामिडल सेप है सो ट्रङ्केटेड पिरामिडल सेप इन इट हेज ट्रङ्केटेड पिरामिडल सेप सो इट हेज द 4 walls के so it has 4 walls है pyramidal shape but still it has 4 walls है 4 walls it has 4 walls okay one apex and one base है so apex base and 4 walls है so एक्जिला मा तीनटा कुरा चाहिँ सम्झिनु पर्यो चारवटा चाहिँ वाल हुन्छ एउटा चाहिँ एपेक्स हुन्छ र एउटा चाहिँ बेस हुन्छ भनेर है सो अब तिम्रो एपेक्स मा गयो भने सो एपेक्स इज नोन एज द सर्वाइको एक्सिलरी canal है सो इट कम्युनिकेट्स विथ नेक है सो एपेक्स मा कुरा गर्यो भने सुरुदेखि जाम सो एपेक्स मा it communicates with neck through the cervicoaxillary canal through the cervicoaxillary canal so cervicoaxillary canal is the apex of the axilla it is a cervicoaxillary canal that communicates with the neck so it is truncated apex is truncated so truncated apex is truncated guys remember apex is truncated भनेको काटिएको पिरामिड है so this is the apex so this is apex and this is truncated this is apex okay and it directs upward and medially so it directs upward and medially so upward and medially so you term पनि सम्झिनु पर्छ directs upward and medially as you can see over here it is directed upward है माथितिर पनि directed छ and towards the medial side so it is directed upward and medially so यसरी चाहिँ upward medially भयो है so formation मा apex of the axilla is formed by so apex को कुरा गर्यो भने यहाँ लेखौँ है so apex is formed by apex को boundaries को कुरा गर्यो भने formed by there is the anterior मा there is the posterior border of clavicle है there is the posterior surface of the clavicle and anterior मा चाहिँ there is the posterior मा चाहिँ there is superior border of scapula and medial मा there is the outer border of first rib so medial मा there is outer border the outer border of first rib so first rib को outer border so cervicoaxillary canal को boundaries हेर्यो भने so it is anteriorly formed by clavicle it is posteriorly formed by the superior border of scapula and it is medially formed by the outer border of the first rib so cervicoaxillary canal यहाँ पनि हेर्न सक्छौ so यहाँ हेर so this is the anterior border which is formed by the clavicle and the posterior border which is formed by the superior border of the scapula and there is the medial border with the outer border of the first rib so this is the first rib ko outer border so this outer border this clavicle and the superior border forms the cervicoaxillary canal this cervicoaxillary canal which forms the apex of axilla so अब यहाँ हेर्यो भने बोन गरेर देखाउन त पर्दैन तिमीहरुलाई बुझ्छौ होला है so apex बाट के पास हुन्छ त है so what structure passes through apex structure passing through apex so apex बाट पास हुने स्ट्रक्चर्स एउटा चाहिँ हो हाम्रो एक्सिलरी भेसल्स है दिस आर एक्सिलरी आर्टरीज एन्ड एक्सिलरी भेन्स है एक्सिलरी भेसल्स because it passes through the axilla the name remains as axillary veins and axillary arteries and the cords of the brachial plexus brachial plexus को cords so it passes through the cervicoaxillary canal so cords of the brachial plexus second point and third point is the long thoracic nerve which supplies the diaphragm so it supplies the serratus anterior there is a long thoracic nerve Okay, lung thoracic nerve which supplies the serratus anterior, right? So it supplies the serratus anterior, right? Serratus anterior, while the diaphragm is supplied with phrenic nerve, right? And okay, so अब चाहिँ अब बेसको कुरा गरौँ है. सो एपेक्स र बेसको कुरा है. सो कन्टेन्ट पनि भने पासिङ थ्रु द बेस होइन. अनि बेसको कुरा गऱ्यो भने सो बेसमा जाऊँ है. सो बेस इज फर्म बाई बेसिकली इट इज फर्म बाई दि है. इट इज फर्म बाई इट इज द कन्केभ डिप्रेस्ड पार्ट के. सो मैले यहाँ चाहिँ एउटा फिगर राख्न बिर्सेछु है. फिगर राख्न बिर्सेछु र एउटा एक्जिलाको यसरी स्ट्रक्चर हेऱ्यो भने सो एक्जिलाको स्ट्रक्चर हेऱ्यो भने यो बेस चाहिँ इज कन्केभ डिप्रेस्ड पार्ट के. सो देयर इज यो काखी हुन्छ नि काखी देयर इज कन्केभ डिप्रेस्ड पार्ट है. सो दिस इज डिप्रेस्ड पार्ट हुन्छ है. डिप्रेस्ड पार्ट है. सो दिस इज नेक है सपोज है. ओके सपोज दिस इज नेक है. नेक देखाउनु मिलेन. Okay, so this is the axilla. This is the axilla, and there is a depressed or concave part. This is depressed or concave part. So boundaries are when base go. The boundaries are it is anteriorly formed by anterior boundary is formed by anterior axillary fold. Anterior axillary fold. Anterior axillary fold. Anterior boundary is formed by anterior axillary fold. And posterior boundary is formed by posterior axillary fold. Posterior boundary is formed by posterior axillary fold. Posterior axillary fold. है. पोस्टेरियर एक्सिलरी फोल्ड एन्टेरियर एक्सिलरी फोल्ड एन्ड मिडियलमा भन्यो देयर इज चेस्ट वाल है. मिडियलमा देयर इज चेस्ट वाल है. द ल्याटरलमा देयर इज आर्म है. ल्याटरलमा देयर इज आर्म. सो ल्याटरलमा देयर इज आर्म. सो देयर आर 4 बाउन्ड्रीज. देयर इज एन्टेरियर एक्सिलरी फोल्ड, पोस्टेरियर एक्सिलरी फोल्ड and the chest wall in medial side and arm in the lateral side. So formed by so it is base is formed by the skin. So skin superficial fascia. Skin superficial fascia. Superficial fascia and deep fascia. So skin superficial fascia and deep fascia. So that forms the base. यो base चाहिँ यसले बनाउँछ. So base वरिपरिको boundary चाहिँ यस्तो यो त chest wall यता. There is the arm यता. There is anterior axillary fold and there is the posterior axillary fold. So यसरी चाहिँ तर base चाहिँ it is formed by the skin superficial fascia and the deep fascia. So it is okay. So deep fascia. Deep fascia मा there is axillary fascia. So deep fascia मा there is axillary fascia. There is axillary fascia extending between pectoralis major and latissimus dorsi. Extending between pectoralis major and latissimus dorsi and teres major. Teres major. So teres major. Okay. So axilla ma I have said 3 muscles. There is a pectoralis major, latissimus dorsi and the teres major. So in the anterior axillary fold, the anterior fold or the anterior axillary fold, the anterior axillary fold is formed by muscle known as that is the pect major. So pect major is originated from the sternoclavicular. There is a sternal head and clavicular head of the pect major and inserted into the lateral lip of the bicipital group. So it has to be passed through the just in front of the axilla and get inserted into the lateral lip of the intertubular sulcus. So then it forms the anterior axillary fold. So it forms the anterior axillary fold is formed by pect major, right? And there is the posterior axillary fold. Posterior axillary fold is formed by the muscles that originates from the posterior side of the body. So there are 2 muscles known as latissimus dorsi and the teres major. There are latissimus dorsi and the teres major. So these are the muscles of the back and the back of the scapula. So teres major is the muscle of the back of the scapula, while latissimus dorsi is the muscle of the back, and it passes toward the anterior side. That forms the posterior axillary fold. Okay, so that is inserted in both muscles. These are inserted into the intertubular sulcus. Latissimus dorsi is inserted into the floor of bicipital group. Latissimus dorsi is inserted in the floor of bicipital group. While teres major is inserted into the medial lip of bicipital group. So medial lip of bicipital group, medial lip of bicipital group, and the pectoralis major is inserted into the lateral lip. It is the lateral lip of intertubular sulcus or bicipital group. So we can remember is a lady between 2 majors. So lady between 2 majors. So in the lateral lip there is a pect major, and in the medial lip there is a teres major, and the lady means latissimus dorsi. So in the intertubular sulcus we can remember is lady between 2 majors. Okay. So base is formed, right? Base is formed. Also it is supported by. So base is also supported by suspensory ligament. There is suspensory ligament of axilla. suspensory ligament of axilla, which also support the base है. There is suspensory ligament of the axilla which support the base. Okay. So base को कुरा आयो. So anterior wall, so axilla को anterior wall is formed by, so anterior wall of axilla, anterior wall of axilla is formed by, anterior wall of axilla is formed by, number one is the clavicle in the cervicus axillary canal. There is a clavicle in the anterior wall, and there is the pectoralis major and minor. There is a pect major and minor, pect major and minor. There is pect major and minor. Okay. So, and there is this one muscle known as subclavius, that is just below the clavicle. There is subclavius, and there is another muscle known, there is the deep fascia of the pectoral region known as the clavipectoral fascia, clavipectoral fascia, clavipectoral fascia, and this also supported by the suspensory ligament, suspensory ligament of axilla, suspensory ligament of axilla. So this forms the anterior boundary of the axilla. So these all structures form the anterior boundary of the axilla. Okay, so clavicle, pect major, minor, subclavius, clavipectoral fascia, and the suspensory ligament of axilla forms the anterior wall of the axilla. Okay, so and the posterior wall. Okay, posterior wall of axilla. So there is posterior wall of axilla. Axilla को posterior wall हेऱ्यो भने, okay, axilla को posterior wall हेऱ्यो भने, there are, one is the muscle of the muscle in front of the scapula in the subscapularis fossa, that is this muscle subscapularis. There is muscle subscapularis that is inserted in the lesser tubercle of humerus, and there is the another muscle known as teres major, which is inserted in the medial lip of the bicipital group, and there is another muscle known as latissimus dorsi, which is inserted in the floor of the bicipital group. So these three muscles form the back of the axilla. The three muscles form the posterior wall of the axilla. The muscles subscapularis, the teres major, and the latissimus dorsi. Okay. So anterior wall and posterior wall are clear, है. Posterior wall and anterior wall clear भयो. So medial wall को कुरा गर्यो भने है, यहाँ यसको फिगरको चाहिँ म पछि एक्सप्लेन गर्छु. So there is a medial wall also. The medial wall. So medial wall of axilla, medial wall of axilla. It is formed by the upper four ribs with intercostal muscles. Right? Upper four ribs with intercostal muscles. So upper four ribs with intercostal muscles. One point is upper four ribs with intercostal muscles, and the serratus anterior, upper portion, right? Upper portion of serratus anterior, upper portion of serratus anterior with its fascia, also with its fascia. Okay, fascia सँगसँगै. So serratus anterior upper portion with its fascia, and there is a long thoracic nerve deep to this fascia. There is a long thoracic nerve supplying. There is long thoracic nerve supplying the serratus anterior deep to fascia. Deep to fascia. Okay. So there is a long thoracic nerve on the medial wall, and there is the intercostobrachial nerve that passes the medial wall. Okay. Sorry. So there is the intercostobrachial. There is intercostobrachial nerve that passes medial wall. That passes the medial wall of axilla. Medial wall. Okay. So there is the intercostobrachial nerve. Right? So this forms the medial wall of the axilla, while the lateral wall is formed by. So there is a lateral wall. The lateral wall of axilla. So lateral wall of axilla is formed by the bicipital group of humerus with a teres major. Bicipital group of humerus with one is teres major. One is teres major. There is teres major. Another is latissimus dorsi. Another is the pect major. Another is the long head of biceps brachii. And another is the short head of biceps brachii. And there is the coracobrachialis. So coracobrachialis. So that forms the lateral wall of the axilla. So these structures form, these muscles form the lateral wall of the axilla. And the contents of axilla, we have to be clear on the contents of axilla. Okay, contents of axilla. So axilla को content हेऱ्यो भने there are axillary arteries and axillary veins. So these are known as axillary vessels. Axillary vessels, and there is the brachial plexus cords. There is brachial plexus cords. There is a brachial plexus cords. Okay, cords of the brachial plexus, and there is the long thoracic nerve. Okay, there is long thoracic nerve which supply the serratus anterior, long thoracic nerve, and there is intercostobrachial nerve. There is intercosto. Okay, so there is intercostobrachial nerve. There is intercostobrachial nerve, and there is the axillary fat, axillary lymph node. Okay, axillary lymph nodes. Like there are axillary lymph nodes. Lymph nodes. Okay, there are axillary lymph nodes. The important point is axillary lymph nodes. Okay, and there is the axillary fat. Okay, axillary tail of spines, axillary fat, and there is the upper quadrant extension. Upper quadrant, upper outer lateral quadrant of extension. Saying axillary tail of spines. There is axillary tail of spines. Axillary tail of spines, and there is the areolar tissue. There is areolar tissue. So these are the contents of the axilla. These are contents of axilla. So then are the axillary lymph nodes. Okay, so axillary lymph nodes को पूरा करें मैंने. There are axillary lymph nodes. Axillary lymph nodes. Okay, guys. So I will explain in later these figures. So there are about 20 to 30 numbers. So axillary lymph nodes are 22 in 13 numbers. There are 5 groups of axillary lymph nodes. 5 groups of axillary lymph nodes. These are known as the line by line. There is the anterior group of lymph nodes, and anterior group of axillary lymph nodes. Now they are known as the pectoral lymph nodes. Pectoral lymph nodes. These are present along the medial wall. These are present along the medial wall. Along the medial wall with lateral thoracic vein. Lateral thoracic vein. So there is a vein known as lateral thoracic vein that are present along the medial wall of the axilla, and there is the posterior, or okay, there is anterior, and there is posterior. Okay, there is posterior, or known as subscapular. There is no posterior, known as subscapular. Okay, it's posterior, also known as subscapular, along the medial wall, along the medial wall, with subscapular vein, Okay, and there is the lateral. Okay, there is lateral axillary lymph nodes. This is present along the medial side of the axillary vein, along the medial side of axillary vein, So vein को axillary vein को medial side में. And there is the central group of lymph nodes. There is central group of lymph nodes, which are in the center of the axillary fat, Okay, and there is the apical group of axillary lymph nodes, which are present at the apex of axilla, So axilla को apex में, there is apical, and there is a infraclavicular. There is infraclavicular, which are present on the clavipectoral fascia. There's clavipectoral fascia on deltopectoral group. So deltopectoral group. So clavipectoral fascia on the deltopectoral group, there are infraclavicular lymph nodes. So I would say, okay. So माथि देखि नै सरलक्क एक्सप्लेन गर्न है. So मैले आज चाहिँ के भन्नु भन्दा एक्जिलाको कुरा गर्न थिएँ है. So you can see over here, this pyramidal shape structure is known as the axilla. This pyramidal shape structure is known as the axilla. Okay. So okay, so you can see over there is anterior and medial skeletal muscle, which I have teach you in the brachial plexus lecture, and this is from where the roots of the brachial plexus, or the trunks of the brachial plexus, emerges, and the divisions of the trunks they merge to form the cords, which enters in the axilla through the cervicoaxillary canal. There is cervicoaxillary canal. So the cervicoaxillary canal has the 3 boundaries. You can see over here, there's anteriorly it is formed by the clavicle, and the medially there is a lateral margin of the first rib, and there is a superior border of the scapula in the posterior side that forms the cervicoaxillary canal, and the medial wall. Okay, so there are 4 walls, and the apex and base. So apex is the cervicoaxillary canal, and there is the 4 walls and the base of the axilla. Okay, so it is the truncated pyramidal space. It is a truncated pyramidal space in the upper part of arm and the chest wall. So apex is formed by anteriorly by the clavicle, posteriorly by the superior border of scapula, medially by the outer border of the first rib. And there are 4 walls, apex and base. So apex, it communicates with the neck through the cervicoaxillary canal. This term is very important. This is a cervicoaxillary canal. Truncated means it is cut. It is cut in the apex. So the pyramid is cut, and it directs upward. So the pyramid directs upward and towards the medial side of the body. So it is directed upward and medially. And the structure passing through the apex, there are axillary veins and arteries, branches and tributaries of the axillary veins. So these are not the axillary vessels, and are known as and this also contains the cords of the brachial plexus. So the posterior, lateral, and the medial cord of the brachial plexus, and there is a long thoracic nerve which supplies the serratus anterior, which has root value C5, C6, and C7 that supplies the serratus anterior, and the long thoracic nerve relates to the winging of scapula, which I had teach you I had taught you in the previous lectures, right? And the base, okay, this is the axillary vessel. This axillary vessel, or as you can see, this is the axillary artery, which is passing through the cervico-axillary canal and is processing towards the arm. So you can see over here it is the axillary artery. Okay, so anterior there is a medial wall, there is upper thoracic wall and the serratus anterior muscle. There is the inlet or cervicoaxillary canal, which is formed by the superior margin of the scapula to the coracoid process, lateral margin of the first rib, and there is clavicle. Okay, so anterior wall is formed by the muscles known as pectoralis major and minor muscles, subclavius muscle and clavipectoral fascia. So these three structures form the anterior wall of the axilla, while the lateral wall is formed by the intertubercle sulcus and the muscles related to the intertubercle sulcus, along with the long and short head of biceps brachii. And the posterior wall is formed by the subscapularis and teres major, latissimus dorsi muscle, and the long head of triceps brachii muscle. Right? So long head of triceps brachii muscle is inserted into the infraglandular tubercle, while the long head of the biceps brachii muscle is originated, my bad, originated from the infraglandular tubercle, long head of biceps brachii, and long head of triceps brachii, and the long head of biceps brachii is originated from the supraglenoid tubercle of scapula, and the base is formed by the anterior axillary fold, which is formed by the muscle pectoralis major, and the posterior side of the base is formed by the posterior axillary fold, which is formed by the latissimus dorsi and the teres major, which are inserted into the intertubercle sulcus in the floor and the lip, in the middle lip of the intertubercle sulcus, and the medial side is formed by the chest wall, and the lateral side is formed by the arm. So at the base of the axilla, there is the skin, there is a superficial skin, and below the skin there is a superficial fascia, and below the superficial fascia there is a deep fascia in the axilla. So deep fascia of axilla is known as the axillary fascia. So deep fascia is known as axillary fascia, and it is extending. Sorry, what is this? Okay. So extending between this is extending axillary fascia is extending between pectoralis major and latissimus dorsi and the teres major. So pectoralis major forms the anterior axillary fold and latissimus dorsi forms the posterior axillary fold along with the teres major. So there is the insertion of the latissimus dorsi on the floor of the bicipital group and the insertion of the teres major on the medial lip and the pectoralis major on the lateral lip of the bicipital group. And these are also supported by the suspensory ligament of axilla. So suspensory ligament of axilla also support the base. So anterior wall of axilla I had already said there is the anterior clavicle, there is pectoralis major minor, the subclavius clavipectoral fascia and the suspensory ligament of axilla. Okay, posterior wall pani yahi kura ho. So you can see over here in this figure. So there is the rib, there is a ribs, so these ribs, and there is the serratus anterior muscle, which is supplied by the long thoracic nerve. This is the long thoracic nerve. There is serratus anterior muscle, and there is axillary fat. Okay, there is axillary fat, and this muscle is known. This is the median pectoral nerve. Okay, so median pectoral nerve supplies the pectoralis major and minor, while the lateral pectoral nerve supplies the pectoralis major, and there is the cord of the brachial plexus, and there is coracobrachialis. There is the biceps brachii long and short head. There is axillary artery. Okay, there is axillary artery. There is axillary vein. There are cords of the brachial plexus, and these are the lateral pectoral nerve. There is the median pectoral nerve. So medial pectoral nerve persists the pectoralis minor and supplies the pectoralis major, while the lateral pectoral nerve continuously supplies the pectoralis major, while it has some contributions to the pectoralis minor, but it majorly supplies the pectoralis major. And there are the muscles. There is a coracobrachialis. There is the long head and the short head of the biceps brachii. And okay, so and there is this upper subscapular nerve. Okay, that is the subscapularis. Okay, so this is the axilla. Okay, this is axilla cervicoaxillary canal. This is axilla cervicoaxillary canal. So anterior wall ko kura bhayo. So there is the okay, there is the clavipectoral fascia. There is anteriorly there is clavipectoral fascia. There is thoracoacromial artery, which is a branch of axillary artery, and there is cephalic vein. There is a lateral pectoral nerve and median pectoral nerve, which supplies the pectoralis major and minor. There is a minor pectoralis major and minor, and there is subscapularis on the posterior side of the axilla. There is a lateral cord, there is a medial cord, and there is a teres major on the posterior side, and the latissimus dorsi, which form the posterior axillary fold. Right? So you can see over here from the outer or lateral border of the first rib. Now the subclavian artery is now called as the axillary artery up to the lower border of the teres major. So it is known as the axillary artery. From here it is known as the brachial artery. Up to this is the subclavian artery. Okay, so there it lies on the axilla. So axillary artery that is located on the axilla. So lateral wall and medial wall. Okay, so medial wall is formed by the upper four ribs with the intercostal muscles. So intercostal muscles are those muscles that are present between two ribs. So these are the intercostal muscles and the ribs. So upper portion of the serratus anterior. So serratus anterior originated from the lateral outer border, outer surface of the upper eight ribs. Upper eight ribs is originated from the lateral outer border of the upper eight ribs and is inserted into the medial border of the scapula. Medial border of the scapula, and there is this serratus anterior is supplied by the long thoracic nerve. So serratus anterior muscle is also known as the buxus muscle, and there is intercostobrachial nerve passes the medial wall. Okay, the intercostobrachial nerves is a branches of the intercostal nerve that supplies the hand. Okay, that supplies the brachium. So brachium is the arm. So the intercostobrachial nerve supplies the arm by piercing the medial wall of the axilla, and the content of axilla, there are axillary vessels, there are brachial plexus cords, there is long thoracic nerve, there is intercostobrachial nerve, there is axillary lymph nodes. Okay, axillary lymph nodes. Okay, so lymph nodes, there are lymph nodes in the axilla. There is axillary fat, and the extension of the outer lateral quadrant of the breast is known as axillary tail of spines. There is areolar tissue. There is areolar tissue. Okay, you can see over here there are lymphatic circulation. So beneath the areola there is a subareolar plexus of Sape. There is a subareolar plexus of Sape. Subareolar plexus of Sape. Subareolar plexus of Sape. Okay, so you can see over here the axillary lymph nodes. There are 20 to 13 number, 20 to 13 number, and there are 5 groups of axillary lymph nodes. They are known as anterior or pectoral lymph nodes, pectoral axillary lymph nodes, axillary lymph nodes. They have anterior or pectoral axillary lymph nodes along the medial wall on the lateral thoracic vein. So there is the lateral thoracic vein. Over here we can see that there is the lateral thoracic vein. Lateral thoracic vein on the medial wall. You can see the anterior group of the axillary lymph nodes, anterior group of the axillary lymph nodes. So okay, and there is the posterior group of the axillary lymph nodes on the subscapular vein. There is a subscapular vein. Okay, waiting, keep on. Okay, so there is a subscapular vein in the posterior, sorry, in the around the subscapular vein, there is a posterior group of lymph nodes. Okay, there's a posterior group of lymph nodes, also known as subscapular lymph nodes, along the medial wall of the subscapular vein. And there's a lateral group of lymph nodes, lateral group of axillary lymph nodes along the medial side of this axillary vein. So there is axillary vein on the medial side of the axillary vein. There is a lateral group of lymph nodes. So lateral group of lymph nodes are present towards the humerus. So these are known as lateral, while the central group of lymph nodes are located centrally in the axilla, in the center of the axillary fat. So there is axillary fat in which the central group of the axillary lymph nodes located, and the apical group of lymph nodes are located at the apex of the axilla, or known as the cervicoaxillary canal of the apex. So cervicoaxillary canal of the axilla. So there is infraclavicular lymph nodes. So these are located just below the clavicle on the clavipectoral fascia in the deltopectoral group. So there is a deltopectoral group in which the muscle deltoid and the pectoralis major forms a triangular shape group. Right? This forms the triangular shape group known as this group is known as the deltopectoral group. This group is known as the deltopectoral group. So in the deltopectoral group there is the infraclavicular lymph nodes on the clavipectoral fascia just below the clavicle, and you can see over here there is brachial plexus. So brachial plexus, the cords of brachial plexus and just enter the cervicoaxillary canal to go to the axilla, and the branches of the cords and the branches are distributed through the axilla. And you can see over here same figure. So these are the cords. So the cords after division they form the cords. Okay, these cords are formed by the fusion of the anterior and the posterior division of the trunks of the brachial plexus, and they enters the cervicoaxillary canal. So this is the cervicoaxillary canal. So this is the posterior cord, there is the lateral cord, and there is the medial cord. Okay, so brachial plexus cord दिखाना हो जाए. Okay, so that much